I would like to acknowledge the co-investigators from UNC Lineberger Comprehensive Cancer Center and also Health Corps on this study. Aggressive medical care for patients with incurable cancers at the very end of life is widely recognized to be harmful to patients and their families. In this study, we examined several items of care which could be considered aggressive at the end of life, and that included chemotherapy, radiation treatment, invasive procedures which could be either biopsies or surgeries, emergency room visits or hospitalizations, intensive care, and also in-hospital death. In 2012, ASCO published a Choosing Wisely recommendation aimed at reducing aggressive care at the very end of life. Specifically, the ASCO recommendation discussed reducing the use of chemotherapy at the end of life, as well as increasing palliative care and hospice use. However, the impact of this ASCO Choosing Wisely recommendation is unknown on clinical practice, and also aggressive care in younger cancer patients is also not being very well studied in previous publications. So in this study, we analyzed insurance claims data in patients across 14 states. We specifically analyzed patients younger than 65 who were diagnosed with metastatic cancers, either lung, breast, prostate, colorectal, pancreatic. These are the 5 very common metastatic diagnoses in this country, and patients who died between 2007 to the end of 2014. And basically what we did is we analyzed the percentage of patients who died with metastatic cancer who receive aggressive care within the last 30 days before dying. And this slide summarizes our key findings. Across these 5 cancers, overall, the findings are remarkably consistent across the 5 diseases. And overall, about 3/4 of patients received at least one form of aggressive care in the last 30 days of life. This included about 2/3 of patients who were admitted to the hospital or went to the emergency room in the last 30 days. About 20% of patients received intensive care, and 1/3 of patients died in the hospital instead of dying at home. In addition, about 25 to 30% of patients received chemotherapy in the last 30 days of life. Radiation treatment was actually used the least of all the categories we looked at, and about 15 to 20% of patients received radiation treatment, and 25 to 30% of patients received an invasive procedure, which could be either a biopsy or a form of surgery. This slide shows the trend of aggressive care across time, and we show 4 of the cancers here, but the 5th cancer had a similar finding. And basically what we did was we looked at the overall use of aggressive care, which you remember was about 3/4 of patients in the previous slide, and we looked at whether this proportion of patients changed over time from Q1 2012 all the way to Q4 2014. And basically what we saw, and remember that the ASCO Choosing Wisely recommendation came out in Q2 of 2012. And basically what we found was that the percentage of patients who receive aggressive care in the last 30 days of life really did not change over time in any of these 5 cancers we looked at. The red line here represents the proportion of patients who received aggressive care from 2007 to 2011, so before 2012, and that red line is also very similar to the trends we saw all the way to 2014. So in conclusion, we found that 3/4 of patients younger than 65 with incurable metastatic cancers receive aggressive care within the last 30 days of life, and that included 1/3 of patients who died in the hospital instead of dying at home. The use of aggressive care did not seem to decrease after 2012 ASCO Choosing Wisely recommendations. We also specifically looked at the use of chemotherapy over time, and we did not find a change in the use of chemotherapy after the Choosing Wisely recommendations, nor did we find a significant increase in the use of hospice from before 2012 to afterwards. Additional efforts are critically needed to improve end-of-life care for patients with terminal cancers to ensure that the care provided meets the goals and preferences of patients and their families. Thank you.